Pastor Vivian to pray for us.
Let's have a word of prayer. Our Heavenly Lord, we give you thanks. We give you thanks for this day. And we pray that as we gather here, you are in our midst. Lord, we are praying that you guide the facilitator. And those of us listening, you give us a listening ear. So at the end of the program, we'll give you praise. Lord, we pray that at the end of the program, what we have listened to will be a point of contact. Those who have these problems will have their healing through you, Christ. In the name of Christ we pray. Amen.
Thank you, Sister Vivian. So straight away, the reason why we're here this evening, I think the topic is a very interesting topic most of us identify with. We're talking about low back pain and sciatica, as doctor says it, the causes and the treatment, modern day treatment. And we have our very own sister, Dr. Naa Asheley Ashitey, a chiropractor with the Nova Wellness Center. Sister Naa, you're welcome. So no plenty talking. Sister Naa will do all the talking. Let's sit back, listen, get our questions ready. I started asking my questions before. Yes. Isaac, the link. Is it? Is it ready? Is it working? Okay. Thank you. Yes. So, Sister Naa, you're welcome. Let's sit back, get our questions ready. Thank you.
Good evening. And it's great to be back, first of all. Yes. I've missed you all. It's very nice to see everybody. So we're going to have a brief discussion. I'll talk for maybe about 30 minutes, and then we'll have enough time to discuss and then see the things that we can all do for these problems, lower back pain and sciatica. All right, so I have my laptop here, but they're going to be controlling from the booth as well. All right, so you all know me already, most of you. So I'm a chiropractor, CEO of Nova Wellness Center. I'm also a certified ergonomist. So I do a lot of ergonomic assessments for companies to help them sit well, use good furniture, and things like that. And then we also do spinal decompression. We'll talk about that here a bit later as we go along. All right. So, a few statistics here. About 80% of the population would have suffered back pain at least within the last 1 year. That's a general worldwide statistic. So, a lot of people have back pain, in other words. Now, fewer than 5% of that number would be good candidates for surgery. So it means that a majority of the people who have back pain can manage it or can treat it conservatively without having to go to the extreme of needing back surgery. So in other words, most causes of back pain can be treated without the very, very extreme surgical procedures. So why is back pain so common these days? There are so many reasons, but technology, unfortunately, is one of the biggest reasons why back pain is on the rise, because all of us are like this, behind our computers, behind our phones. You know, I did an assessment for a company, and I went to somebody's office, and they had a screen here, a screen there, phone, another one here. So the whole day he's doing this, that, you know. So that screen time is so much, which maybe our mothers or our grandmothers did not have. Okay, so that's one of the things that they are attributing this surge in back pain to. Now, this study, there are a few studies here, and these were done during COVID, when everybody was working at home. So they're saying that 63% of the people felt more productive at home, but then 71% of the people also had more back pain, neck pain, poor posture, headaches, eye strain, sleeping problems, and all these you can attribute it to technology issues. Okay. So what are the facts? 25% of spinal surgeries resulted in increased instability. So what that means is, if you don't control this back pain, and God forbid, you end up having surgery in one area, a few years' time, it causes instability in another area. Because once, I keep telling people, even when something falls in your eye, your own eyelash falls in your eye, see how painful it is. So imagine having spinal surgery. And sometimes they'll even put rods, what we call spinal fusion. So it causes instability. And then if you're not careful, 2-3 years down the line, you will need surgery again. So just so that we all see how important it is to do the little things we can to prevent us from getting to the point where we will need surgery. So spinal degeneration is common after surgery, and then the biomechanical changes that happen after surgery. So what is the best way to resolve back pain then? I'm sure that's what we all want to know. So we call it conservative care. Conservative meaning natural, little to no risk, no hospitalizations, no secondary care needed. Okay, so conservative means that you go in, you do your thing, you can go back to work, you can go back home. You are not staying in hospital, you are not being admitted. So there are a few examples that I've listed here. We have chiropractic, we have physiotherapy, there's massage, there's acupuncture, there's non-surgical spinal decompression, and then there's regenerative medicine. So chiro is what I do. I'll talk about it a bit more. And then we also have physiotherapy. A lot of people ask me, what's the difference between chiro and physiotherapy? So we'll do that when we do the questions and answers. Then there's massage therapy. There's acupuncture. Acupuncture uses mainly needles. So they use some tiny, tiny, tiny needles where the pain is. And then there's non-surgical decompression, and then regenerative medicine. I'll talk about those here in a bit. So we'll do a little bit of science. How many of us did science in secondary school? Yes, Doc. And passed. Small. So we'll do a little bit of anatomy here to see what you all remember. Okay, let me grab this. I think I could even do without the mic, but for the people online. So this is what the spine looks like, okay? Now, over here, we have the skull. So the skull protects what? The brain. All right. Doc, you're not allowed to answer the questions. All right. So, yes, the skull protects the brain. Now, everything here, these small bones you see, is what we call the spine. And then there are different areas. We have the cervical, the thoracic, and then the lumbar. And then over here, we have the pelvic bone as well. Now, the extension of the brain. So the brain sits here, like we rightly said. Now, the extension of the brain is the spinal cord. So when the brain stops here, its extension is what goes all the way and ends somewhere in the lumbar spine, and we call that the spinal cord. So that's the soft material inside. And then the bones around the spinal cord are what we call the spinal vertebrae. Now, like I said, there are three regions. So the cervical, the thoracic, and then the lumbar. Now you can see there are some yellow branches in between the vertebrae. That's what we call the nerves. So this is why the spine is so important, because that is what maintains your nerves. And your nerves are like your lifeline. Okay, so I always say the brain is like the sender. It sends the information. Your nerves would be the cord in which the information will pass through. And then your end organs will be the receiver. So your muscles, your organs, the tissues, they receive that information. And then the vertebrae is what covers all these things. So if any of these vertebrae should go out of their normal position, it impinges the nerves, and that's where the problems set in. So I just talked about the nerves, the cells, the tissues, and all of that. The brain, the spinal cord, and the nerves make up a certain system. Let's see who remembers what that system is. Since a few people said they did science, the nervous system. Is it Auntie Vivian? Bravo. So yes, the nervous system. Now the nervous system is your master system. It's like your computer's CPU. That's what controls everything that you do. Your heartbeat is controlled by the nervous system. Your respiration, your digestion, everything comes from the nervous system. So you realize that if the spine and the skull is what protects that nervous system, then it's critical, and we really need to take care of it. So we call something the posture system, and that is what surrounds that nervous system. And its purpose is to protect and also resist gravity. Gravity is something that we don't even think of that it exists. But without gravity, we'll all be falling all the time. We can't stand up, right? So that gravitational force is so essential to make us stand upright, to make us sit without collapsing, okay? So your posture system protects your nervous system and also helps you to resist gravity. So what happens when this posture system goes out of whack or goes out of place? So if you look at the picture on the screen, the one in green is normal. So the shoulders are even, the hip or the pelvic bone is also even, the knees are even. If you look at the picture closer to the left, you can see distortions. So the shoulders are off, the hips are off, the knees are also off. And sometimes when people have very severe things like scoliosis, where the whole spine is crooked, as they walk, you can see this with your naked eye, okay? But what is happening is that the structures inside are also not balanced if you have these distortions. And over time, they start to create problems. They start to cause degeneration. They start to, even in worst case scenario, like people who have a very bad scoliosis, it starts to affect how their heart would function, their lungs. Like if the spine is bent that way, for instance, worst case scenario, those organs will also be affected. So that is why it is so important for me as a chiropractor to check to see what that structural frame is like. so that if things are off, then we know how to at least try to correct them. So those are the things that we do. And the purpose is to try to bring you back to equilibrium as much as possible. I always tell people, like a child, my own daughter, when I had her neck, she had torticollis, so she came out like this. But because I'm a chiropractor, I had a chiropractor friend just do some small click, and she was fine. 1 week. Very easy to correct. But as we get older, it becomes more difficult to correct these things. So the earlier, the better. Now, we're looking at another two pictures. The one on the right is like that. Unfortunately, a lot of people I see have this posture. We call it posture collapse because everything is rolled in like that. Now, they will come in and say, Doc, I have pain maybe here. I don't have any lower back pain. But if you look at the picture, you see that their head is forward, their shoulders are rounded, the hips are also sunk in, but they only have pain here. So this posture creates so many problems. And it may not necessarily be the pain you are having. That's the unfortunate part. Because if you do this over time, your tissues, your organs can also be affected. And you may not necessarily have pain. So I always tell people, pain is just a signal. It tells you that, hey, watch this, you know. But if you continue taking painkillers to just take off that pain, you haven't solved the problem. And that's why it's very important that we don't just ignore the pain. Oh, every day I get up with headache. I get up with headache. Then painkiller, painkiller, painkiller. Yes, it may be killing the pain, but what is causing the problem? That's what we need to check. So postural issues are very, very important. Sometimes people say, oh, but I exercise. Shouldn't exercise be enough? For some problems, exercise may be enough, depending on how long you've had it for, how old you are, what is causing the pain. All these things would add up to whether or not exercise would help. But I always want to know what the root cause of the problem is before we decide if exercise would be a solution. So posture is key. You realize I'm talking about posture a lot. To correct a postural problem, you must first correct the alignment of the posture system. So that's why a lot of the conservative care that I mentioned, we look at the posture system. If you look at chiropractic, it's about the spine. If you look at acupuncture, they use these needles to stimulate certain areas of the body. If you look at massage therapy, it's the muscles that they are working with. If you look at physiotherapy, they are working on the joints. So you realize that all these conservative treatments are working on aligning some parts of the posture system. So how do we do this complete postural correction? With our mode of treatment, we do spinal alignments, then we do posture rehab. Posture rehab is a set of exercises that are designed for you based on the problem that you have. Okay, and then posture habit re-education. A simple posture habit re-education is how we use our phones, for instance. You know, Joyce is like, how we use our phones. All of us are like this all day long. So that is something that we need to re-educate ourselves on so that we don't do the wrong thing. So we're going to go through the most common causes of posture collapse. So as you go through these, I want you to see where you may be guilty yourself. And then we'll figure out how to correct them, okay? All right. So repetitive occupational movements is the first one. And this could be anything. This picture is showing somebody who is using a computer, obviously. So typing is a repetitive motion. which causes something we call carpal tunnel syndrome, very commonly. So because of that repetitive thing, your wrist starts to hurt. It could be lifting, is your repetitive motion. It could be twisting. You know, those in the manufacturing industry, maybe whatever they are doing entails bending here, taking something, putting it there, and so on and so forth. So all these things we can put under the repetitive occupational movements. Sedentary lifestyle. Don't tell us if you are guilty, just put it in your head. So if you look at this cartoon, you can see this guy, you know, he's lounging, and he's probably like this all day long. What kills me is the things on the floor. He has a can of Coke, he's got some chicken, he's got some pizza, you know. So this is what we call a couch potato. He's just sitting in the couch all day long. Very, very sedentary. If you look at this guy, look at his neck, and he's also working on the computer. So he's literally like this. And look at his stomach. You see? So this is sedentary lifestyle. Not only is his posture horrible, he's eating the worst things possible, and he's stuck in that couch all day long. And trust me, there are lots of people doing this. Lots and lots. And these are the people that are developing all those ailments. And they don't even realize that they are developing them. The hypertension, the sugar issues, the cholesterol issues, obesity, this is what they do and how they develop it. So sedentary lifestyle can also lead to these things. Sometimes people don't understand. But I don't do anything. Oh. You know, people come to my clinic and say, oh, but doc, minko baby, debi mitifie, inti menti asese mechi, minye juma. And I'm saying, yes, that's why your back is hurting, because you don't do anything. You don't move, you know. Your joints are stiffening up by the day because there's no motion. So motion is great. We were having a discussion before we started that I will never recommend, no, don't exercise, don't move because you have pain. If you don't, the pain is just going to triple. You need to move. You just need to know what to do and how to do it properly. So looking at the first two things, these are some simple things. I'll teach you when I want to do the presentation, then we'll go back and look at some of these things. But we call something posture breaks. For those of us who are still working at our desk, it's great. After every 45 minutes, you take a posture break. And I'll show you some of the exercises you can do when you take a posture break. But even apart from the musculoskeletal aspect, when you take that 5-minute break, it's even good for your circulation, for your ability to focus, you know. Once you come back, you realize that you have more energy, you're able to focus more, regardless of even the spine stuff. So it's very, very necessary that we take a break every so often when we're working. Sitting habits, how we sit, is also a very common one. You know, if you look at this lady, her head is stuck down because the laptop she's using is way down. Again, we'll talk about some solutions for the laptop. She's like that, hand is somewhere, and so on and so forth. So we need to watch how we sit. It's so bad that a term has been coined. It's called sitting disease. It's called sitting disease. And it's got to do with the long periods of sitting, with poor posture, head down. It comes with neck pain, back pain, numbness in your hands, and so on and so forth. So all those things put together, we call it sitting disease. All right. So how do we fix sitting disease or poor sitting habits? One of my favorite all-time things to use is a laptop stand. Again, those of us who are still working in our offices or even at home, get a simple laptop stand. This one will fit into your purse, like this. It comes with a small bag. You can put it in your purse, take it to the office, bring it back home. For those of us who bring work home, you always use your laptop stand. So what it does is it simply elevates the laptop. So if you look at that picture there, you can see me using a laptop stand. And then the trick is to make sure that the topmost part of the screen is about your eye level. This alone makes tremendous change because now you've gone from this to that. So laptop stand, I highly recommend. Now behind or next to that picture is what we call a sit-stand capable desk. So a sit-stand capable desk, it's high-tech. So I haven't been to, but I hear if you go to a Google or Microsoft or Amazon, the people who are always doing the tech work, they don't have offices. It will be like a huge room like this, and everybody has a sit-stand capable desk. They stand more than sit. Reason being, these people noticed that all of them were struggling with back pain. All of them, because their work is behind the computer. So they would rather invest in these things, and you can roll them, you know. So instead of sitting and making phone calls, do this, do that, you can just roll your desk to the next person and you continue your work. So a sit-stand capable desk is another alternative so that we are not sitting for too long. Technology terror, we were talking about the phones earlier on. So I don't have my cell phone close to me, but as you can see in those pictures, they are all doing that. Okay, and the painful one to watch is with our children. You know, when I was 2, I don't think I knew what a cell phone is. But I have a 6-year-old who knows my phone more than I know my own phone. I'm sure some of you can relate to that. Yes. So these kids know how to use these gadgets left, right, center. And my worry is that the problems that we are developing now, because we've been using phones in the last, 10 years or 15, whatever, they are going to be experiencing those problems when they're 15. So it is essential that we control how our kids use these gadgets, how long they keep them for. I was reading a research not too long ago, and they were saying that even apart from the poor posture, you know, anytime you have a phone, there's some radiation that comes, you know, and the kids' brains are not even that developed to be able to take in that radiation. So we really need to minimize how much time we keep the gadgets. And it's a necessary evil. They have to use them because of the age we're in. But in my house, for instance, we minimize it to the weekends. You know, I try to find interesting ways to prevent them from having the phones all day long, every day. So let's help the kids to do those things. What is the proper way to use a phone? So on your left, you have that person doing that. On the right, you have that person holding it up. So holding the, yes, doc, like that. It is very weird, I know. She's like, what? It's very weird. But it's only weird because you're not used to it. It's a habit. I mean, I won't say that I've never done this, but once I remember or I catch myself, I come up, you know. And it may not necessarily be that you have to do like that, but definitely don't do this, like where your chin is literally touching your chest, you know. So I want you guys to be at least conscious of it, to try and bring your phone more up to you as opposed to you taking your head into the phone, okay? And then the kids too. So we need to reverse what we call this flexed neck. Again, it's so common that it's called text neck or tech neck because All this technology is what has led to this particular problem. Then our purses and handbags is another one. And then for our kids, again, the school bags. The school bags. You know, my kids go to Christ the King, and it's been a battle trying to reduce the amount of weight the kids take to school, because I'm like, it's ridiculous. My 8-year-old school bag, it's probably heavier than she herself. You know, you have to get a dragging bag and all that. So the cumulative effect is the problem, because if they are in primary school and they have to be dealing with carrying heavy school bags, what happens when they get to JHS? What happens when they get to university, and so on and so forth? So we need to pay attention to these problems, and even how they hold their bags is important. Your bag is heavy, then you put one hand. Then you are walking like this because it's so heavy. You know, all these things can lead to, and if you come to my clinic, no joke, from 4 to 5, it's like children's clinic, because kids after school who have developed back pain. So this is also very important. And for us women, our handbags. I can't tell you how many women will come to the clinic and they have pain around the shoulder and the numbness in the arm and tingling, you know. And sometimes as they are walking, I'll just look at their bag and then I'll pick it up. I'll say, hey, auntie, this is your bag, you know. So it's very important. We need to see the things that we can take out of the bag quite frequently so that we are not carrying these heavy bags around. Because what happens is you may start off with heavy bag, one shoulder, but you see in your neck, the nerves run right here. So, and there's a network of nerves we call the brachial plexus. And you see, when you carry a heavy bag, you naturally do this because you are trying to support the weight. So as you do this, your head too is bending this way. So over time, your bones will start to degenerate, and then they'll tell you have cervical spondylosis. Spondylosis is just a fancy term for degeneration or wear and tear. Now, when you have that cervical spondylosis, first it will start with the bones. That will start to chip a bit or wearing out. Then the next thing, you see this red thing here, that's the disc. The way God created us, between every two bones, there's some rubber or there's a disc there. And the disc is there to separate the two bones so they don't rub. But when you start getting spondylosis, then slowly that disc too will start to thin out. It will start to thin out. And the disc is like a balloon. So when it's thinning out, then, oh, my disc is spoiled. But the gel inside will pop. And that's what we call a disc bulge or a disc herniation. So when it pops like that, it puts pressure on the nerves. Once the pressure starts hitting the nerve, that's when the numbness starts, or the tingling, or the weakness. We call that neuropathy. And it's the neuropathy that's usually when people feel, then they think it's stroke. Then they'll say, my whole arm, so I thought I was getting a stroke. No. Most of the time, it is not a stroke. It is from your poor posture that has continuously gotten worse and led to that neuropathy, okay? So we need to watch that. Lifting, how we pick up things from the floor. I can't tell you how many times I've heard, oh, me pen keke neto fomo, me kotu se me fa ena me take crack, ewa mechi. I don't know how many times I've heard that statement in my life, you know. So it's not even what you're lifting, but it's how you're doing it. So it doesn't matter that is the pen. It doesn't matter that is the heavy box. The fact that you're going down, you need to watch it. And especially as we age, muscles are not as strong. Joints are not as flexible. There's stiffness. We have to be careful in how we do these things so that we don't injure ourselves. So this thing here, as you can see with the red sign, bending over like that is a no-no. Is a no-no. Your thigh bone or the femur bone is the thickest bone in your body. So you should use it and squat. If you can't squat because of poor knees, you can use one knee and then go down slowly. Do your best. Do your best. But this thing that you bend all the way, it can cause a lot of problems. So let's avoid that posture. I see there are a few men here. I was going to say, when I was going through my slides, I was going to say, so when you go home, tell your husbands. But I see the special men in here. So, so here we're talking about the wallet. Now, this is key. We talked about sciatica earlier on when we started. One of the most common causes of sciatica is putting your wallet in your back pocket. That's one of the most common, and I'll explain why. So this is the spine again. This is the pelvic bone. So your pockets will be right here. Now, there's a big nerve called the sciatic nerve. Today, I've taught you plenty science. So the sciatic nerve starts from about lumbar 3 or lumbar vertebra 3, and it runs from there through the back of the pelvic bone all the way to the bottom of your foot on both sides. So when you put your wallet here and you sit, you are sitting directly on that sciatic nerve most of the time. So wallet is here, but there's nothing here. You create an uneven surface, and then the nerve too is under that wallet. So that's what you're seeing in the picture. The picture on the right, you can see the wallet is right under the pelvis, and you see how the pelvis has been thrown off. Because of that, the spine is also off, as compared to the other picture where there's no wallet. So again, over time, when that sciatic nerve has been so impinged, you start to have pain from the root, and then you say, it goes all through my leg. And that is the path of the sciatic nerve. That is why it's called sciatica, which is simply pain from irritation of the sciatic nerve. So how do we solve this? First of all, we have to remove the wallet. So when I assess men who come to the clinic, the first thing is, if they have sciatica, where do you keep your wallet? And half of the time, just removing that, they don't even want to come back, because then they'll realize a change. So removing your wallet from your back pocket is key, very, very important. Okay. Then physical trauma. I always want to bring this up because sometimes people forget about the accidents they had 30 years ago. It may be a car accident, it may be a fall, it may be a slip, it may be even carrying something improperly. But that physical stress or trauma, and you see, when it happens when you are younger, the body is robust. It deals with it. But as you get older, then the stress starts to show up, even though the incident happened 20, 30 years ago. It's when you're getting older that it happens. So for instance, I have a lot of soldiers who come to my clinic, not when they are active. Once they hit 60, 61, then it's like all of a sudden, they don't know where the pain came from, you know, and it's the years of trauma that their bodies have gone through. So physical trauma is also another cause for these problems. So how do we correct some of these things? This is a simple exercise, okay? And I put this slide here because a lot of the time people think we need intense exercise. We need to go to the gym. We need to get a trainer. But this is a simple core strengthening exercise that is great for your back. Just this morning, I was talking to a patient and she says she has a big stomach. So she's been doing crunches. I said, hey, and you have back pain and you are still doing crunches. Don't do crunches, but she wants flat stomach, so she's been doing crunches. But there are safe exercises you can do. This is a simple one-leg balance exercise. But if you do it religiously, it's going to really help to strengthen your core. If you have a strong core, your back doesn't go out easily, okay? So these are some of the simple things I want us to do. Shoes. Somebody says Asamaba. Shoes. I really admire when I see people wearing these things. It looks very nice, it looks sexy, you look very confident. It's like, but what is happening in your body is another matter, okay? If you look at this particular thing, this is like a good 6-inch, okay? Look at her toes. The toes that are supposed to be like this are now like this. And then the whole ankle. Now we're only seeing the foot and a bit of the leg, but the shoe is actually affecting your entire body from the foot up. Because imagine that you are walking on your toes. There's no way I can walk on my toes without bending my knees. As I bend my knee, my hip is also bent. My spine will also have to compensate. So you are doing like this at work every day, climbing stairs, up and down, And again, this problem, usually you don't feel it whilst you are doing this. It's when you stop. So when you retire and you're not doing it anymore, then your toes will start going left and right. We call something bunions. Bunions are caused by this. That's when your toe looks deformed and then there's some extra tissue. It's high heel shoes that causes bunions. Most of the time. Some people too is genetic, but outside of the genes, it's high heel shoes, okay? This is something you can avoid. So I'm not saying don't wear high heel shoes at all. I wouldn't do, me personally, I can't do above 2-3 inches, because as the inches go up, the compensation for your rest of the body also goes up. You can do block heels. That's fine because you're not going to be bending your whole body like that. Or wedges are also fine. But this 6-inch, I don't recommend it. And especially not for work, where you have to be walking, up and down. Sometimes you're climbing stairs. You're going to a wedding, you only dance small, you walk, to your car and back. I'm not too concerned about that. But to work, I don't recommend it at all. Restless posture, or I'll say sleeping posture. How we sleep is also another major thing that causes back pain and sciatica. So sleeping, and the reason why sleeping is so key, is that about 6-7 hours a night you're sleeping, right? So that's a chunk. That's a chunk of if you accumulate all, I think on average, it's like 2/3 of your life you'll be sleeping. I'm not sure about that, but it's something like that. So if you don't do that activity well, just like how sitting during the day can be bad, sleeping at night improperly can also have effects on your spine. So it's very important. How many of us like to sleep on our stomachs? Stomach sleepers. Stomach sleepers. I like the way Daddy's laughing in the back. He knows I'm about to say something. So sleeping on your stomach may be very comfortable, but it's the worst sleeping posture. It's the worst. Auntie Teresa says you sleep very well. You know, sleeping on your stomach is not good. And I'll explain to you why. Now, you see the spine here has some curves from up all the way down. That's how God made the spine. Now, when you sleep on your stomach, this is what is happening, this way. Now, because of gravity, remember we talked about gravity. Gravitational force is always trying to push you down, and the spine is what resists it. So now when you sleep on your stomach, these curves, gravitational force is attempting to straighten them as it pulls you down. That's number one. Number two, if you leave your head straight like this, can you breathe? No. So definitely, you have to twist your neck like this. So for the 6-7 hours you're sleeping, twisted neck, if you're sleeping on your stomach. So most people who sleep on their stomachs, they'll tell you, when I wake up, I have some discomfort, but when I walk small, then I'm okay. It's true. But this is the worst sleeping posture for your spine. Okay, so we don't recommend it. We only recommend it for babies. As they develop their curves, they'll tell you, put the baby down. Even that in America, they say you shouldn't do it. But the purpose is to help the curves to develop. Once the curves are developed, you don't need to sleep on your stomach anymore. So the best way, and most people don't like this, but the best way is to sleep face up. Auntie Mavis says, no, 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 no. So sleeping face up, and I've heard so many stories. Let me see if I can get a new one here. Why can't you sleep face up, Auntie Joyce? You can't breathe. It's tiring. Any more? You won't sleep well. Any more? Yes, ma'am. It's true. It's true. It's true. You're right. Yes, yes, Dad. When you sleep face up. Okay. That's the first time I'm hearing that one. Okay. All right. There's always a first. Manet people, you are very rabba. The things I've heard is that if you sleep on your back, the witches will come for you. Or if it's not the witches, it feels like you are dead because you are in that position. Okay. Snoring. Nobody said snoring. Snoring is another very common one, that if you sleep on your back, it makes you snore. Okay, so these are all reasons. I'll start with mom's own. So remember I mentioned the curve. So yes, there's a lumbar curve. And if you have a big backside, usually that curve will also be very deep. So when you sleep on your back, it's like there's an empty space and it makes it uncomfortable. You're 100% correct. So how to deal with that particular problem is to put a pillow under your knees. Sorry? It doesn't work for you? Or? Yes. Yes. So what I recommend is you put the pillow here. Now when you put the pillow there, it helps to balance your legs and the lower back region, because now there's something there creating a more even surface. So that's how you deal with the curvature in the back. But if you can't still sleep on your back, you can do the sides. that's also okay. You can either sleep on your left side or on the right side, but it's very good that you switch sides so that you are not constantly only sleeping on one side. Because as you do this, you see, I'm overstretching here and I'm squeezing here. So when you switch, then you get the opposing effect. So those are the pictures you can see there. So the very first one, I don't know if those at the back can see, but there's a pillow behind the head, it's blue, and then there's another pillow under the knees. And then in the middle picture, there's the side sleeping, and there's a pillow under the head and one in between the thighs. That also helps. And that also helps to bring balance in the hips when you put the pillow in between. The last one is the stomach. Like I said, we don't recommend that one. So back to solutions. Conservative care, conservative care. And I want us to see how, if we don't have any back pain or any spine problems, how can we keep it like that and prevent it from happening? So some of the things we've already talked about, the sitting posture, taking frequent breaks, all those things, being more mobile at work, sit-stand capable desk, all these things will prevent or slow down the degeneration rate so that it doesn't get bad. You need to find doctors you can trust. It's very, very important, especially here in Ghana or maybe most parts of Africa where sometimes our regulations are a bit shady. You have to make sure that you're going to the right people for treatment. You want to prevent spinal surgeries. Very, very important, as much as possible. Seek 100 different opinions and let them all say that this one is only surgery before you go in. It means that you have waited till the thing has gotten to dying stage, and that's the last option. I always pray that people don't come to me when it gets to that point, because there's nothing I can do. So let's take care of ourselves. Let's pay attention. If you need to be seen, the earlier, the better. Oh, what's happened here? All right. So at Nova Wellness Center, which is where I work, we've been doing this for, it's actually 10 years now, not 8. We've been doing this for a while, and these are all the things we use. They are all natural, so everything we do there is conservative. We do the chiropractic adjustments, which I'll describe very briefly. I work with the spine, I look at x-rays, I do tests to figure out which of the vertebrae may have gone out of place, and then I use my hands to very gently adjust it. That's why we call it the chiropractic adjustment, to make sure that the spine is better aligned. So that's me there doing a chiropractic adjustment on somebody's neck. So that's the premise of my practice, because I believe that, or chiropractors believe that, if the spine is in its optimal shape or alignment, then all your nerves flow and your nervous system works better to make sure that all the other systems are also working well. So that's what a chiropractic adjustment looks like. The next thing here is what we call the DRX 9000 spinal decompression. So this is now technology. Now we also use some technology to treat neck and back pain, especially those with the numbness, the tingling, the neuropathies. So what this machine does is, like I described, when the disc gets thinned out, this machine has some form of a traction device, and once we attach it to the specific level, it tractions it out. So it kind of does something like this. It pumps at that level. So as it's pumping, it opens up the disc space so that the nerves are free to flow through the arm or the leg or wherever you're having the numbness, tingling, and so on and so forth. We also do massage therapy, and this works very well. And there are some people that may only need a massage because they have very tight muscles. And there are some people too that it will be a complementary service to, or it will complement the other things, the decompression, the chiro, and so on and so forth. But I strongly recommend massage for highly stressed people, for people that do a lot of repetitive motions, like the typing, the twisting, because your muscles get tensed. We have sauna treatment and so many other things in our spa that all help. Again, all natural, all conservative. Then this is my latest new baby, I call it, but my favorite treatment that I have personally just started doing at my clinic. It's called regenerative medicine. Now with regenerative medicine, still all natural, we're using your own blood platelets. Okay, so this is not new generally, but in Ghana is a bit new. So the athletes, for instance, use it a lot. The basketball players, and so on and so forth. So we take out your own blood, just like how blood is drawn in the hospital. We spin it in a centrifuge, and then the platelets come up. We harness the platelets, and then we would inject it where you need that regeneration to happen. Your blood platelets have some factors that are responsible for regeneration. So we are pretty much introducing the platelets where it needs to go and do that. And the results are just mind-blowing. So I now use it for joints, so a lot of the knee pain, elbow, shoulder. We're talking about plantar fasciitis, that's pain under your foot. So that's what I use the regenerative medicine for, and it also works very, very well. So I'm wrapping up now, and I'll take some questions. But bottom line, I don't want you to ignore the pain, the signs, the posture imbalances. Maybe as I was speaking, you're thinking, oh, I have this problem. I need to get it checked. You know, I would highly recommend that you do get it checked sooner than later. If you do, it's easier to treat it now than in the next 5 years. Or it's not that serious now. Maybe next year I'll come. By then, it will be more difficult to treat it, okay? So we have conservative treatments, no drugs, no surgery. I'll be more than happy to speak to you if you need it. What we would typically do is a posture screen. We'll look at your x-rays or MRIs or both. CT scans, whatever scans you have, you can bring them. If you don't have anything, we can start with some x-rays at least, and then you would have an initial treatment. That is what typically happens on the first day, and then we give you a plan. A lot of people say chiropractic takes long. People say you go for the rest of your life, and so on and so forth. We have treatment plans that go from 2 months, usually 2 months to 6 months, but everybody is different. So depending on your peculiar case, we'll curate a plan that will benefit you the most, okay? So thank you. I will take your questions now, and then we'll do some demonstrations with some exercises and things that you can do on your own as well to help. Thank you. Yes, sir. Please go ahead.
Yeah, good evening.
Good evening.
Very happy to be here. You didn't speak about sleeping sideways. The sideways.
I did.
Most often. Oh, really? Okay,
Yes.
then. I didn't hear that.
You were not paying attention. Okay, so ask your question about
Yeah,
sleeping on
so
the side.
most often.
That's
one
how
of-
you like to sleep,
Yeah, I sleep very well.
on your side.
Yeah.
Okay. So that's fine. Just I recommend you switch the sides so that you are not constantly sleeping only on one side, but you consciously alternate the sides.
Okay, secondly, thank you so much. The sciatica, I think just 2 weeks ago, I started experiencing serious pain.
Hey, then this one, God brought me here for you.
Thank you so much.
All right, you're welcome. Any other questions? Or yes, ma'am.
Good evening.
Good evening.
Um, you were talking about standing working. As the chefs and the cooks in the kitchen, they stand more often. And I'm doing my national service, and then I'm also in the kitchen cooking like 8 to 10 hours. So by the time I come back, I feel the pain under my feet or my lower back. And I find it easy when I bend the whole waist. It makes me feel comfortable. But then that is wrong. So what do I do?
Good. Very good question. Thank you for bringing that up. So for cooks, people who are standing for long, even our servicemen and all that, few things. Your shoes become very, very important. So that's one thing you can control. You need shoes that have a good sole. It's extremely important. Otherwise, your tissues will be wearing thin. If you are wearing flat shoes that don't have any support, for instance, it's just a ticking time bomb, because every time you're standing, you're putting so much pressure, your whole weight. So the first thing I'll tell you, get good shoes. A good pair of sneakers works. Crocs work, because Crocs, for instance, is flexible, but at the same time, it really supports your whole body weight. Or a good pair of sneakers is fine, but not flat shoes or slippers like chalewote or anything like that when you're standing to cook for hours. No. What you also want to do is that in between, just like how I said, don't sit for too long. You do your best. Maybe it may not even be standing. You can move from standing to walking. You understand? So you walk in between the standing. If you can, sit. If there are some of the things you can do while sitting, switch from the standing or walking and sit a bit and go ahead. Stretching is different from sharply bending to pick something. Do you understand what I'm saying? So you are stretching. It's a very slow movement. And if it's something you've been doing, your muscles know it. You are not going to snap your back by stretching downwards. And yes, touching your toes is a good exercise, actually, but done properly, as opposed to something drops and you just bend quickly and pick it. That is when you hear the click sound. So stretching that way is a good way to kind of open up your back and reduce the pain. So these are a few tips I can give. And then, apart from touching your toes, you can move out from wherever you're cooking or whatever, rotate a bit. If you have a surface like your counter or whatever, you can put your hand on it, stretch your back. All these things to at least help you manage yourself whilst you go. I don't know, for those of you who are on social media, there's a lady in Nigeria who cooked for 100 hours non-stop. And you will see that in between, she was stretching, they were massaging her back, and she was doing all these things she was doing, because after standing for so long, your muscles get stiff. So same thing. Okay? All right. Any other questions? Yes, Auntie Doris.
Thank you very much, Doctor, for the presentation. When we are in the office, I want you to demonstrate the best way to sit.
Okay.
And where our arms and our hands should rest when we are working on our laptops and our computers. Okay. And then after that, recommend the best chair.
Okay.
So that our backs will not ache.
Okay. All right.
Thank
Great.
you.
Good. So this is not an office chair. There are different types of chairs. So every chair has its features depending on what you're using it for. I always say, like your sitting room chair, it's almost impossible to sit straight in a sitting room chair because it's not made like that. It's made for you to kind of lounge and relax. Same thing, okay? This chair is like a waiting area chair. Okay, so it may not necessarily have all the perks, and it's fine because you won't sit in it for more than 30, 45 minutes. So this is an okay waiting area chair. But I'm just going to use this to do a few demonstrations. So when you sit, okay, I call something the 90-degree rule. So as I'm sitting now, I can draw a couple of 90 degrees. So from my shoulder to my hip to my knee is 90 degrees. Then from my hip to my knee to my ankle is also another 90 degrees. The minute I do this, no more 90 degree. The minute I do this, no more 90 degree. The minute I do this, no more 90 degree. So think about 90 degrees and you are golden, because that way your spine is up, your hips are square, your knee and your ankle are also even. So that is one way when you look at the sitting posture. Now, when it comes to chairs, I always tell people you can have the most expensive chairs. There's chairs that cost like 20,000 Ghana cedis. But you can go and buy that chair and still sit in like this. So what was the purpose of buying the 20,000 Ghana cedi chair? Totally waste of money. But any chair you have, whether it's a bench, even without a back support, you can still attempt to do your 90-degree rule. So it is how you're sitting in the chair that is important and not necessarily the chair. Of course, if you are looking at an office chair, it has to be a good chair because you're sitting in it 8-9 hours. So I wouldn't put a plastic chair in an office for an employee to use. So you need some things like a good lumbar support. This chair I'm sitting on doesn't have a lumbar support, and it's fine because it's a waiting area chair. But your office chair, you need a good lumbar support. You need adjustable arm rest so that depending on what you're doing, you can even pull it up or down. You need a good headrest. This chair doesn't have a headrest. Again, it's okay. So for your office, there are a few things that you should look out for that would help. But most importantly, it's how you will sit. When you're using your computer, again, the trick is your arm should be about parallel to the table, not perpendicular. So if it's perpendicular and you are typing like this, you see what's happening in my wrist? But if it's like that and your keyboard is here, then you are maintaining something like this. If you're using an elevator, and the reason why I like, there are different types of elevators, but the reason why I like this particular one is that it slants the laptop keypad so that you don't have to do your wrist like that. So office-wise, these are a few simple tips that you can use. For people who use a desktop, most of them have an adjustable knob at the back. But most people just, you buy it or they buy it for you and you use it as a setup. So it's just a matter of adjusting it, and it should be able to come up to about your eye level, the top part of the monitor, and then you can use it without bending downwards. Okay? All right. There's a question from online, actually. I see that. Can car sitting or driving affect the spinal cord negatively? I think there's more. If you can please scroll up so I can read the rest. And then I'll answer it. Okay, so car sitting. It's still sitting. It's still sitting. It may be difficult to achieve the 90-degree rule in a car, but do your best. Do your best. One thing I recommend for people who have maybe a long commute. You live in Afienya and you are working in, Kaswa. Thank you. So from one end to the other end, you want to get a small pillow. Yes, like the chair backs, like the things we have in the pews, or maybe a little bigger, and then put it in that curve, like Auntie was talking about. There's a curve in your back, so you can put that pillow there, and then when the pillow is there, it will be very uncomfortable to slouch as you drive. It will help support. So I strongly recommend for drivers, people who are in the car for a long time, just put a small pillow in the small of your back, and it will also help keep your spine straight. For the drivers who do long distance, I think the regulation is that every, is it hour and a half or 2 hours, you have to stop. You have to stop. And when you stop, don't just stop and sit in the car. Get out of the car and walk around, do something, stretch. It's very important for circulation. So those are a few tips for the cars. Yes, Auntie Mavis. Hey, you people have found a new member here.
Yeah, Doc, is there any correlation between motion sickness, and the movement of the neck?
I have never been asked this question before. Motion sickness and the neck. I don't know if it's just the neck, or I think motion sickness is more of a reaction of the motion to your entire body. I don't think I would take just the neck, although it may cause neck stiffness. The body is so dynamic that your motion sickness might cause neck stiffness. Her motion sickness, it might be lower back. You understand? So I think it's a reaction to that movement that the whole body experiences, and it may not necessarily be what's happening in your neck. It could affect any part of your body, really.
And I have motion sickness.
Okay.
Every time I travel, and he said something about I need to put on my neck brace.
Brace when you are traveling.
Because I think there's something about the brain.
Brain and the.
I didn't actually get it.
Please, I'm going to research it tonight.
Okay. Thank you.
I would definitely read up on that, and I'll give you feedback. All right.
Okay.
Yes, ma'am.
Can I also find out about the sizes of the pillow?
Okay.
The one you put in between your leg and behind your. Do they
Okay.
have to be the same size?
Okay. So, great question. Thank you for asking that. Pillows, even before I go to the size, you just need an average simple pillow, not the orthopedic, curvy one and all those things. I don't recommend those. The purpose of the pillow, again, the curves. So your neck also has a curve. So most of us have a straight neck, so you don't realize it. But if your neck is not straight and it's up, there should be some space between here and your upper back. The pillow is just supposed to close that space. That's the purpose of a pillow, nothing else. So if you are using 2-3 pillows here, you are causing more neck problems. You see, if you put 2-3 pillows here, you are pushing your head forward and causing something we call anterior head carriage, which most people already naturally have. So one simple pillow, it doesn't have to be flat or too soft. It should be a bit firm, but not soft, like not the pillow that you've used for maybe 10 years and all the, thing is out. So it should have some girth to it, but just one. And the same thing would go in between your thighs or behind the knees. Yes. So one pillow is all you need. Yes, Auntie Audrey? Or no pillow. Yes, or no pillow. But there's a caveat to the no pillow. So if you are more comfortable without a pillow, it means that you don't have a curve. That's why your neck is straight. So when you sleep without a pillow, there's a curve that is created there naturally. You understand what I'm saying? Because if your neck is straight and you put a pillow, you are pushing it. But if your neck is straight and you sleep like this without a pillow, you are creating that curve. So that's why most people who have very straight necks, when they tell me that, it almost becomes like I'm a magician. But when they tell me, oh, when I sleep without a pillow, I'm more comfortable. And I'll tell them it's because your neck is straight. By the time we do the x-ray and it comes out, very straight neck. So it makes sense, because when you now lay like this without a pillow, you are more comfortable, so you're able to sleep. But then we need to also fix the straight neck. Yeah. Yes, Auntie Joyce. Oh. Yeah. Is it on? Maybe it's working. It's not working.
Hello. I said I promised to be good. This is about the wallet,
Wallet.
bit. I just wanted to be sure. Are we talking about an empty wallet or a full wallet? Because I said I would be good, but it's important. Oh? Is it full of call cards?
Or 200 Ghana cedi notes.
Yes, so that it is worth
trouble.
talking about it. Thank you.
All right, so Auntie Joyce is asking about the wallet. If the wallet has to be full with call cards, empty, or full with 200 Ghana cedi notes. So even if it's empty, the fact that there's something on one side but not on the other side can still cause an imbalance. If you feel both, if you fill both out, then you'll be in a better shape. Yes, yes. So you are either putting two wallets, and it's not even wallets. It could be a handkerchief. It could be a handkerchief, or maybe an envelope. So just let's avoid putting anything in the back pockets. Yes. You're welcome. Any other questions? Yes, Auntie Doris. Please, I'm listening. Oh, sorry.
Okay, I want to find out if you have numbness in your fingers, your fingertips.
Yes.
Is there an exercise? Because sometimes you are working and you just feel it. And you are touching your screen, your phone, and it's so numb. Then what exercise can you do so that immediately you are comfortable?
Okay.
So that you can continue. That's the first thing.
Okay.
And then you ask the first question, sorry. Then you said wallets, whatever. Okay. So women, we don't have wallets. But we have sciatica. So what causes it?
In women?
In women, because,
Okay.
and I said two questions, but is it in both legs? Can it come in the right and the left, or is just one part of the body?
Great. So true, pure sciatica is usually one side. So if it's purely only sciatica that you have, the classic one is usually one, and it could be either left or right. But sometimes there are other things in addition to the sciatic nerve. So you may also have something we call facet atrophy. So that's the joint between the spinal vertebrae. The cartilage there too has worn out. So you may be having the sciatica on your right, but you may have facet atrophy on the left. And the facet atrophy can also cause the radiation down. So you may realize that those people will say the numbness on my right leg goes all the way to my foot, but my left leg, it stops at the knee. or things like that. So then that's like a combo of sciatica and something else. But if you have only classic sciatica, it is usually on one side or more severe on one side, yes. The fingertips. So the fingertips issue is tricky because most of the time, the problem may not necessarily be your fingers. Most of the time, it's coming from the neck. Yes, because when the problem gets bad in the neck, then it starts to radiate and then it gets in your fingers. So if you want to focus just on your fingers, you may realize that you will do plenty things. The fingers will still be numb. So you want to look at your neck instead of the fingers itself. If it's a true fingers thing, maybe poor circulation, then you can get these like stress balls. And then just squeeze, and it's a good exercise. Or there's some that looks like a scissors, like a very, like a grip exercise, very hard, and you can do that as well, it will help. Or you can get a surface and just kind of do this, do the different sides, stretch it out, and those things will help. That is if the problem is coming from your hands directly. But if you do all these things and you don't get any relief, then you know that it's not your hand per se, but it could be coming from the neck. And then once we're talking about neck issues, then you need more tests and things to figure out what's going on before treatment. I want to show you guys some simple exercises as well before we finish up. This is what we call a TheraBand. This is something that is very simple, but it does 10 million things. And I highly recommend it in your office space, even at home. Once, if you go online, you see plenty TheraBand exercises you can do. But I'll show you the simple ones that you can do at your desk. So for the people who have the neck pain with maybe rounded shoulders, discomfort, when you take that 5-minute break, you can pick your TheraBand and then do these simple exercises. So I'll put the microphone down so I can show you. What I'm doing is, I'm doing reverse text neck. Because don't forget that the text neck, we said everybody's like this, right? So you realize that what I was doing, I was pushing my head back. So I'm doing opposite of what you would have been doing at your 5 inches ahead of the rest of your body. So this is a good exercise to help pull your head back, strengthen your neck muscles as well. And you can also do it for the sides, for those of us who have pain on the side. So same thing. You just switch it to one side and then resist. And then resist. And then you make sure that you tense. Yes, it stretches. It's very, very stretchy. Okay? And then you can decide to keep folding it and it becomes tighter. So you can do this for your neck. What we call a TheraBand, yes, and it's very, very affordable. Okay, so that's that. I don't know, did we bring more TheraBands or just this one to demonstrate? Do you have TheraBands? There's some here. Okay. Oh, okay. We have a few. Just 3. All right. Yes, sir.
Yeah, my very last question. How should we wake up
From bed.
from bed?
Good. Trying to think, see if I can demonstrate.
Can I also add one?
Yes, Uncle Sir, you're welcome.
What does massaging do to all of this? Or
Okay.
can massaging help in any of this?
Sure. Yeah,
instances?
so massage is more for your muscles. You know, massage therapy caters to the muscle. So there are different types. There's what we call Swedish, which is light, so they don't go in deep. Then there's deep tissue massage. And then there's also what we call hot stone massage. So all of them is geared towards relaxation or easing the tension in the muscles so that they can support the joints better. So yes, for some people, all they need is a good massage. For some people to, Lee's in trouble. For some people to, they need a very, very deep tissue massage, and those ones can be painful. So you will do that when you've been doing massage for a while. And the hot stone is like a Swedish or deep tissue massage with a stone. Usually we recommend that for people who've had a stroke, for instance, because the stone, when put on certain points, helps to stimulate the nerves again. So yes, massage can help with these problems as well. Okay. So how to get up from sleeping position? I'm very tempted to sleep on this thing here because it's like I'm home, right? So yeah. Okay. So if you are sleeping face down, which you shouldn't, so I'm just not. So let's sleep face up. So when it's time to get up, most people do this. Right? That's how most of us get up. You just up and go. But from here, you can bring one leg up, roll to the side. This is not very comfortable because it's tiny. So as you're rolling, then you bring your legs down. Then with this hand, you can bring it here, and then you push yourself up. Okay, I don't know how clear it was, but that's the right way to get up. The whole idea is you want to avoid that bam. Because you see, you've been laying down for 6-7 hours like this. Then when you just move the spine so quickly, that can also cause some spinal problems. So the best thing is to sleep on your side, elevate one leg. So it's like the leg that you are elevating is what will help you to roll. And then you use the hand, and then you pick yourself up slowly, okay? If, for whatever reason, you were laying face down, so you are face down and you are getting up, the best thing is to go on your knees. So you're on your knees, and then you can walk yourself down. So again, you are avoiding that bam, flexion of the spine. And if you are laying on your side, then you just continue like I showed you from the face-up position. Okay, great question. Yes, ma'am. I think we are, last question. Okay.
How the pain, sciatica pain,
Sorry,
looks
what
like.
pain? Sciatica, okay.
The pain, how does it look like? Because after age retirement, I begin to feel something in my body.
Yeah. Okay.
Not my bones,
Okay.
none of my bones is paining me.
Just that side.
But the both sides, both. It's like nerve pulling me. And I don't know how sciatica pain is. So I was describing it to my doctor, and he is telling me it's sciatica.
Okay.
But the two, when you wake up,
when I wake up, I can't walk. I can't even carry a baby to walk. So I asked, oh, Sarah, come and help me with the baby. So I'll go to the hall and then take the baby. So, in fact, I can't understand. So when I went to the hospital, I was describing it to them, and he told me that it's the sitting. I've been sitting down too much.
When you were working.
Wearing heel too much. That, in fact, even if I wear heel, I feel okay. But the doctor said I shouldn't wear heel. Because when I'm at 70, it will be more painful. And the way the thing is paining me, right now I wanted to wear down shoe, but I wear something a little
Small.
just to relieve me from that pain. Because I can't walk.
Okay.
When you wake up in the morning, I have to ease myself before I
You
can
feel
walk.
some comfort.
I have to drink water, ease myself before I can walk well. Because when I complain, they did endoscopy and then colonoscopy for me. But still, the pain is there. So this fish man and shark, there is a fish, something for massaging.
Okay.
Yesterday, I did dolphin.
Okay.
Yesterday, I massaged myself. This morning, it was worse.
Hey.
Oh, it's true. It's true. So
Okay.
yes, I don't know whether what is doing me is
Sciatica.
or because the whole of my year before 60, I was feeling
Fine.
I was fine.
Yeah.
And sitting for about 37 years at office and then wearing heel. After that, then the doctor said I'm adjusting to.
I think you missed the first part of my talk because I described you.
Okay.
Yes, that you wear the high heels is when you stop. That's the
Uh-huh.
pain comes.
It's
So
severe.
I can't tell you if you have sciatica or not.
Yeah.
It is possible. It's apart from you describing the symptoms, sciatica is obviously diagnosed by looking at some scans. So if all those other things have been eliminated, you've done a colonoscopy, you've done everything, and they said it's fine, it's not there, then we would want to probably look at some x-rays or MRIs to see if there's any disc problem or lumbar spinal vertebrae issue that is putting pressure on the sciatic nerve.
Yeah.
That is when it can be diagnosed. But just from your symptoms, it is possible. So what I'll say is that you will need to be fully evaluated before we can say that, yes, it's a sciatica. And if it is sciatica, then there are treatments that you can do.
Because the doctor gave me
Medication,
like
painkillers.
I'm on B-Deck, I'm on Lyrical, so many things that I'm taking, some suppository before I can even walk.
So those medications, again, it will cover the symptom, but usually the
It can't
cause
cure.
of the problem is still there.
It's still there.
So we have to go to the root cause. So we can talk after
All right.
the meeting and then we'll see how best to help you. All right, thank you so much. The last thing I want to show you before I go is another favorite exercise. I want you guys to have the things you need so that just in case you don't see me for 1 year, at least you can do something. So this is called a wobble board. Okay, this one there, this is the only one we have. So I know we didn't bring more. But this is also very good for moving your body or your lower back. Okay, so it's a disc, but you fill it up like a balloon. So you can move forward, backwards, forward, backwards. You can move side to side. You can draw an 8. And it's very, very, very good for the lower back as well. Okay. Joyce. I don't know what she said. So a wobble board is something you can also keep in your office or at home, and it's also excellent to help with back pain. So I think I'm done. Thank you very much. It's been great coming back, actually. It's been great coming back. And I'm going to hang out a bit more. So if you have one-on-one questions, I always give Manet church members some discounts on our treatment plans. So yes, when you come, just tell us that you are from Manet and you will get the discounts, okay? So if you are interested in coming to the clinic, we'll just take your name and your number. We'll call you, we'll schedule your evaluation. If you already have scans, bring them along. If you don't, that's fine. We have x-ray at the clinic, so we can take x-rays there. If you need MRIs or anything more, I'll give you a script to go out and do the scan and bring it back. But bottom line, and then we have some laptop stands. We probably brought one. But if I know the numbers, we'll arrange to bring you some TheraBands, some laptop stands. The only thing I know we don't have is the wobble. But we have, yes, I'll get some for you, Auntie Joyce. How much is the laptop stand, Isaac? 250 Ghana cedis for the laptop stand. So if you can, maybe Auntie Eugenia, if you can get me a list of whoever wants a laptop stand, then I can arrange it to be delivered to you guys. Yeah. Please, feel free. Auntie Joyce wants to try the wobble. So thank you very, very, very much for the very warm welcome. It's been great. Maybe I'll come to church on Sunday.
Thank you.